Good afternoon, everybody, and welcome to today's Better Managers Briefing. Each time, every week, on Friday at this time, we bring you updates on the management topics that matter. And today, I'm delighted to welcome two companions who are both experts in dealing with young people and in mental health, which is a major issue of this pandemic. So please join me in welcoming first Kate Newhouse, who is the COO of Kooth, an app that specializes in mental health for young people, and also Jo Owen, who is a serial social entrepreneur, founder of Teach First, and a best-selling author whose latest book is all about resilience. Welcome to Kate and to Jo. It's great to see you both. Now, CMI's research into the negative impact of the crisis shows that mental health and well-being is certainly one of the top impacts, but it's specifically acute when it comes to the younger generation. And I know, Kate, this research, this chimes with your research at Kooth. What are you seeing in terms of the mental health issues and concerns for young people?
Yeah, thank you, Anne. I'm delighted to be here. So, I mean, unsurprisingly, the demand for online mental health support and counselling is rising. At Kooth, we are accessible to over 5 million children and young people in the UK, and we've certainly seen an increase in demand of almost 20% if you compare to the same period in 2019. Another interesting element is that there's a general change and significant increase in some of the presenting issues when you compare to 2019. We can see this from Kooth discussion boards, comments, peer discussion, and the actual counselling sessions themselves. So whilst we're seeing a reduction of anxiety and concerns in peer-to-peer relationships, we're seeing a dramatic increase in health anxiety, sleeping difficulties, and suicidal thoughts. So if we look at the increase in issues for children and young people in August 2019 versus 2020, we can see sleep difficulties up a staggering 262%, wow. Eating difficulties up 104%, and self-harm, suicidal thoughts up nearly 40%. And just to end on a specific is that actually we've seen that those service users from Black and non-white backgrounds are showing higher levels of self-harm, suicidal thoughts, depression and anxiety than white service users. With the suicidal thoughts as a presenting issue being an increase of 10% higher in Black and non-white service users compared to white. So yeah, we are certainly seeing a significant shift year on year.
So those are some pretty stark statistics there. Jo, what are your thoughts as to some of the reasons why this might be?
Oh, I was listening to that agog. I was hoping I could sort of follow up and provide an antidote to that. I don't think I can, unfortunately. This young generation, there's a lot of talk about the snowflake generation, which really irritates me. The reality is, put a lot of snowflakes together, you've got a blizzard, and that's what this generation is. It's a generation which is coming into a blizzard. So I ran a education commission with the major unions, employers, Royal Society, OECD, etc. And what we found was that the education system really isn't fit for purpose. It is not preparing children for life. It is preparing children for exams. It's an exam factory system. with the result that it is not good for their mental health. So OECD puts England in particular, second from bottom in terms of child well-being. I mean, that's terrible, and that's what we've just been hearing the results of just now. COVID has made that worse, with educational inequality is clearly growing massively during this period, and we're going to be seeing the consequences of that for the next 10, 20, 30, 40 years. And then even if you do get into work, if you're wrinkly like me, you can say, well, working from home is actually absolutely wonderful because we have a nice place to work. But actually, if you're new to work, you haven't got the skills, you haven't got the networks, you don't know what to do, you haven't got the support, and you're probably trying to work from home in a flat share where you can't really work from home. So this is really, really tough, whether you're in education or work. And actually, I'm not surprised to hear the data that we've just been hearing. It's depressing, but it's not surprising.
Yes, well, indeed, some pretty stark statistics, and as your study showed, some underlying issues even pre-COVID, now worse in COVID. So what do you think that government, employers, and educators need to do to address some of the issues that you have identified here? I know it's a big question, but Jo, what are the top things you'd like to see done about this?
Well, let's just take a couple of things, because as you say, it's huge. But the first thing is government needs to take mental health seriously. We are taking the pandemic seriously, the COVID pandemic, but there is a pandemic of mental ill health erupting alongside that, which is being ignored, and we need to take it seriously because that people are suffering. And actually, once you take it seriously, as with COVID, you will find solutions. On the education side, there is a need for a fundamental sea change in the nature of education. So the findings commission, and this is employers and unions and all the learning societies together saying, look, we need to shift the system. So it's about helping the next generation become world ready, not just exam ready. And if you just take that principle, everything else changes. And frankly, employers need to change dramatically as well in terms of thinking about leadership and management and how they actually work in this new world, because this hybrid working isn't a temporary shift, it is a paradigm shift. And actually, it's a great opportunity to raise our game massively in terms of how we manage people and help them become the best of who they are.
And we'll come on to discuss some of that. But before we do, Kate, what would you like to see government and employers do to tackle the issues that you've identified?
I mean, I agree with Jo. I think firstly, a recognition that this has disproportionately negatively impacted the mental health of a generation. And then very close to that, there needs to be a focus on putting in measures, support and interventions to proactively manage this. And realising that those measures are a key building block for the recovery, so that other opportunities or initiatives that are put in place can actually be capitalised on, and that their positive impact will actually be felt. If you don't deal with that building block, that any other initiative that you put on top of that won't have the positive impact that you want. And I think on a positive note, I think it's fair to say that there has been more of an openness and transparency in terms of talking about the mental health impact. You can see it splashed all over the newspapers and it's part of the sort of the media conversation. But it's not enough to have an open discussion. We need to follow it up with consistent, robust and comprehensive initiatives. We need the practical steps to follow.
Yeah, I think that's absolutely true. By the way, we will be taking questions later on in the broadcast. If you have questions you would like to ask, please put them in the chat box and we will get to as many as we can. But meanwhile, we've talked about, COVID having a lasting effect on this generation's values, or indeed how they view their prospects. I mean, Jo, you referenced that. Kate, what do you think some of these effects will be longer term for this generation?
I think the two-pronged effect on this generation is overwhelming. So on the one hand, as Jo was saying, it's disproportionately impacted young people from the younger generation's job market entry, their career prospects, their job security, with disruption to public exams, which is the current methodology, even if it's not the right one, 6 months of their education, and then the economic impacts on that. And then you compound that with that lack of social interaction, restricted access to open spaces, and those confined living conditions, which again, disproportionately in those that are in their early stages of their career, you have this double-pronged issue. And I think we're coming back to the conversation before about it has to be a three-pronged attack on it from employers, government and education, and really recognising that it is a disproportionate impact on that generation.
Yeah, no, I think it's a great point. Jo, what do you think some of the impacts will be? You referenced them lasting for decades. What are they?
Well, I think inevitably we won't know for a long time what a lot of the impacts will be. I think from my narrow perspective, I think one of the most chilling impacts will be on educational inequality and then social inequality. So all the evidence is that children who come from relatively well-off backgrounds have done relatively well in terms of keeping up with education. Children who come from lower socioeconomic groups have basically lost 6 to 9 months education. And all the evidence is from the past that once you start off behind, that gap doesn't close, that gap gets wider and wider each year. So this is really acute, especially for like 5, 6, 7-year-olds. They're going to just get further and further and further behind. And at that point, you don't know what the consequences will be when you have essentially a group of people who have lost out in the education system, who are dropping out of the system overall. The social consequences just don't bear thinking about. So there is a kind of urgent need to invest massively in these children back on track, because otherwise they're going to suffer for a lifetime, and everyone else and society will suffer as well.
Well, picking up on that point, you said let's change the system of exams. What do you think they should be replaced with?
Well, I think there's both substance and process. So substance, we need to move from just measuring how literate and numerate people are, because in a world of AI, if you just land up with numerate and literate children, you land up with essentially second-rate computers, and second-rate computers do not have much of a future. The future belongs to people who double down on what it means to be human and the skills of being human. The dealing with other people, dealing with ambiguity, dealing with conflict, leading teams, being creative, finding solutions. All this stuff is incredibly important, but very difficult to assess in an exam. So arguably what we need to do is move much more first of all, we need to measure and help people acquire those skills. That's the first thing. And in terms of assessing it, we need to move much more towards a sort of judo belt, music grade sort of system, where it's not pass fail, but as you reach another level of competence, when you are ready, you are recognized for having achieved that level of competence. Because at the moment, the exam-based system essentially ranks children. I know it says it doesn't, but essentially it does, which means that 30% of children are guaranteed to be told at the end of their school career, you have failed. So they start life being told you are a failure in life. And they know that message is going to be coming to them for several years in advance. So surprise, surprise, they check out. And then guess what? You have all the problems of truancy and antisocial behaviour and that flows.
Okay. Well, if I can just cut in there, Anne, I think that needs to sort of go hand in glove with mental health literacy. Mm-hmm. That self-awareness, that management of self, well-being, understanding that impact, which I do think we've come a little bit further along the way during COVID. Actually, I think that's one of the positives. Needs to go hand in hand, I think, with that sort of complete upturning of what we need for the next few generations.
Yeah, so we have been talking about a lot of the negative impacts, and you just referenced there, Kate. There may be some silver linings. For example, those more human traits of leadership have arguably become more important. The attention to well-being. What else do you see as the positives, Kate? And do you think that they'll last once we've vanquished the virus?
Yeah, so I do think there are some silver linings. In fact, at Kooth, we have a Slack channel named exactly that, so colleagues can post ideas, tips, stories, and thoughts that they have in mind. But I think worldwide there has been an appreciation and a practice, actually, of the benefit of just standing still and working out how and what we should be grateful for in that moment. And I think that's a really special thing that I hope that we hold on to. Additionally, employers and public health organisations have acknowledged that preventative and proactive mental health is no longer a nice to have. Now, it remains whether or not investment follows in that, but I think that has been acknowledged. It's also proven how quickly organisations can adapt effectively to change, not across the board, but has really shown that we can do that with little notice and shows what's possible. And for me, that's exciting and inspirational. And as you referenced, Anne, I think we've seen communities come together in new ways. Mm-hmm. We've seen each other in our own homes, our spaces. We've been forced in a good way to understand and be sympathetic to personal circumstances, bring more of our whole self to work. And therefore, I think that has had, as you mentioned, a positive impact on promoting authentic leadership, showing that one size doesn't fit all. It goes away to prove that there are different styles of leadership that work as well or better than the traditional models that dominated the last century. So I think those are all positives. And I think there's been a step change in a record amount of time in two areas. One is around recognising how important and fragile our mental health is without that active support and management, and also demonstrates the power of digital. So I think both of these present lots of opportunities for educators, employers, and the younger generation to recognise this and proactively manage the former, but also look at new career pathways, skills, and education in the latter, so in digital. I know Jo will know this more than me, but I attended another webinar recently where it was pronounced 85% of the jobs that exist in 2030 don't exist now. So we've had 2 to 5 years of digital transformation in the last 6 months. So that presents, for me, a lot of opportunity.
Yeah, and that's a great list. And, we've just done a major piece of research we'll be launching next week that confirms a lot of what you've been saying there. But Jo, what are your silver linings, and which ones do you see lasting, and, how can we help them to last?
Well, I've got at least 2 silver linings. The first one, with my leadership hat on, I think that this pandemic is the best possible thing that has happened to leadership in about 100 years. And here's why: because it's forcing us to raise our game massively as leaders and managers. When you're in the office, leadership and management is relatively easy. Informal and ad hoc leadership is actually very effective because you can see who's coasting, who's struggling, who's demotivated, who isn't. If there's a problem, you can fix it. If there's insecure communication, you see it and you can fix it. It's all very easy. None of that happens remotely. You cannot do informal and ad hoc management when you are remote. You have to be far more purposeful and deliberate about everything you do, about how you communicate, how you motivate. The first person to figure out how to motivate by email will make a fortune, and a fortune which is not going to be made. Okay, so you have to be more purposeful and more deliberate about communication, motivation, goal setting, helping your staff with their mental health issues, etc., etc., etc. So if we can learn those skills remotely, it'll make us far more effective when we get back into the office. And that is the second silver lining, which is, before the pandemic, everyone hated the office. And now we're suddenly going, you know what? The office is quite a good place to go, isn't it? For all these things, which you can't do at home, like all the creative stuff, problem solving, network building, social networks and professional networks, etc. Offices serve a really important purpose. So perhaps when we're on that commute to the office next time, we will suddenly start to value it rather than hate it. But we are going to be going to hybrid working. It's going to be half and half in the future. Yeah,
no, that's a great point. And of course, many people do want to keep up that hybrid working and that flexibility. But okay, we've talked a lot about some of the silver linings and the impact of COVID, but I'd like to ask each of you as leaders, what have you learned in this crisis? And what advice would you give to those on the call today as to how they can look after their own mental well-being and boost their resilience? Kate, what do you think?
So again, not to sort of agree too wholeheartedly with Jo, but it's been a wake-up call for me on the need to focus on communication more deliberately. So the need to think more innovatively about how to deal with those issues that are presented by remote working, which then means when we go back, we'll take those thoughts with us. So how to collaborate effectively, how to deliver training and on-the-job support of more junior staff that would normally in an environment pick up by sitting next door to somebody, asking questions, looking over someone's shoulder, hearing somebody on the phone. That is really tricky to then replicate in a remote environment. So it's been brilliant to really try and grapple with those issues. And I think it's even more important to restate your position on your purpose, your values, what brings you together as a community, and the important issues, diversity and inclusion. How do you foster and cultivate that diversity of thought when you are all working remotely? So connection, internal communication, adaptability, change management are all the skills I've had to really kind of hone in my leadership. And ones that I think will have to, not just for leaders, are those that will really need to hone for all people coming through into the new job market over the next kind of 10, 20 years.
Mm-hmm. Yeah, that's some really good advice there. And Jo, what about you? What have you learned and what's your advice?
Well, I think I've been incredibly lucky here because my last two books, first was on global teams, which is a remote teams on steroids, and next one was on resilience. So both of those were like perfectly designed to cope with this. So every time I've been struggling, I've just gone into the book and said, I've been learning, so what should I be doing? It's been great. But look, there are a couple of things that really come out for me. The first is, if you're suffering, it's not about you. It is actually about the situation. There's not something wrong with you. There is something wrong with the situation. All right. So don't take it all on yourself, and don't suffer alone. Okay. Leadership is no longer about the lone hero. Leadership is team sport. So it's the old thing: problem shared is a problem halved, and a joy shared is a joy doubled. So get help, and relationships count, even if they're on Zoom. So, and just as much you get help, give help as well. Okay, because even the giving help is a great way of helping yourself. So, help yourself by helping others. Right, that's the first bit.
Yeah.
The second, and Kate referenced this, it really helps to have a sense of purpose. And I don't mean some grand vision about, I'm going to change the world, but be really clear about, what do you want to do in the next year? What do you want to do in the next 3 months? What do you want to do in the next week? What do you want to do tomorrow? Right? And then be really clear about that and give yourself a structure and a goal. So you don't just wake up and go, what am I going to do today? No, it's like discipline, right? Here's what I'm going to do, and do it. Sorry. And there's a final trick, okay, that I'm going to just give that really helped for me. This is the Recovering Pessimist's Guide to Optimism. And I should know, because I'm the recovering pessimist. In gloomy times like this, there's a lot to be gloomy about. So how do you get out of that gloom fest? Well, at the end of each day, just write down, it's important, write down 3 things that went well or you enjoyed. Okay?
Yeah, that's a really important point. And Kate referenced the need to be grateful. Thank you. I really want to get to some questions now because we have a lot. So the first question comes from James. How can the paucity of mental health resources be reconciled with the spike in the demand for mental health services due to the impact of the pandemic? Kate, how would you take that one?
I mean, it can't really, is the first line of the answer. We have seen local authorities and NHS trusts up and down the country respond to this and look at, for example, investing in Kooth to deliver that accessible, preventative and proactive support for children and young people. So it is in pockets, but in the main, my first answer stands is that it's very difficult, and we need to look at that and we need to invest more.
Yeah, and I had an NHS chief exec on the show that was saying that they are going to invest millions in mental health. They're going to have to. So anyway, the next question is from Andy. A lot of work in recent years has taken a good amount of the stigma away from mental health problems. Do you think that COVID might have removed any residual stigma in society? Jo, what do you think?
Well, certainly from a lot of the executives I talk to and work with, in public, they all say how wonderful everything is. You then talk to them in private, and they do tend to do a face palm and say, actually, it's really tough, it's really hard, I'm struggling. Mm-hmm. So suddenly, all these masters and mistresses of the universe are sort of going, you know what, there are some serious issues here. It is difficult. I've been there. So I think that is going to be changing the mood music a lot. And I would say that actually, in terms of the mismatched resources, this is where employers have a role to play in prevention. Okay, yeah. So to reduce the demand by making sure that the workplace is not a toxic culture, but one in which mental health issues are respected, and you create a culture in which mental health issues don't arise.
Yeah, I think it's an excellent point. Kate, do you think the stigma's almost gone now, or what are your thoughts?
I think we've had a step change in it, but I don't think it's completely gone. I think we need to get the transparency of in particular leaders talking about it and showing their own vulnerability around that. We're not quite there, I don't think, but yes, I think we definitely have seen a sea change, and that's a really positive thing.
Okay, our next question comes from Dee. Do you think that mental health should now be seen as just as much the responsibility of leaders as their duty of care to provide safe working conditions? So that's an interesting one. Jo, what do you?
Well, the answer is to say, well, yes, of course. Okay. But then you have to pause and think about, so why might that work or not work? And I think there's a problem. There is still a problem with language, as Kate was perhaps hinting just now, that if you present it as a mental illness problem that they are responsible for, you'll get a lot of negative reactions, because they'll say, we're not in that business. If you turn it around and say, actually, what you've got to do is create a culture where people can sustain performance at a high level for the long term. So you make it a very positive culture where people are positively thriving. Every leader is going to say, well, of course I want that. Of course I want that. But actually all you're doing is you're addressing the mental health problem in a very constructive and positive way, that way, by saying, let's create a culture in which everyone thrives and continue to thrive. So I think it's how you position.
Yeah, it's a fair point. But Kate, you were saying that leaders also should acknowledge mental health issues. So how would you answer the question about the responsibility of leaders?
I think it is. I think, again, in terms of the pause, how you do it is not an easy question. But I think part of showing that vulnerability as leaders and being open personally about it will help create that culture. And then it's the actual, what are the building blocks? What are the actual initiatives and actions to go to sustaining that within a working environment? So both the way in which we work with each other, but when things aren't going well, what's in place to fall back on? So that preventative right the way through to when there actually is a crisis, how is that managed?
Yeah, and maybe talking about it. I mean, our gold medal winner talked about when he needs a break, when his resilience is down, he walks his dog and his dog has a sign, please don't walk me anymore, because he's been on so many walks. So that's an anecdote of that, how he shared some of his issues. So our last question here comes from Colin. Do you think perhaps mental health issues have always been there for young people, but maybe we're asking more questions and young people are more prepared to ask for support now? Kate, what do you think? You cited all those stats before.
So I'd certainly speak to my counsellors, my chief clinical officer, to find that out. I'm not clinically trained. I think, but from my position, I think they have. I think they're different now, so they have changed over time. Certainly, so we're an anonymous service. I think we see some presentation of issues and exploration of thoughts and mental health because of that. So I do think there has been an element of being much more open about it and showing them. I think they were just locked up before, and they do emerge at some point or certain triggers, but we just didn't. We had a different environment in which they weren't allowed to come out.
Mm-hmm. And Jo, your thought?
I mean, it's a totally different world. I mean, a little bit of disclosure. I am on the spectrum, which I only discovered very late in life. And part of the reason for that is that it simply wasn't recognised as a problem. I mean, it simply wasn't known as a problem when I was at school. So I sort of lived with that, and I knew it was different, but I had no idea why. So it is a very different world, and it is in many ways far, far better. But we're not there yet.
Yeah.
So,
but we're trying, and I think this has been a really great conversation. Thank you to the both of you. And just remember, everybody, if you are feeling not okay, it's okay to feel not okay. What Jo said sticks with me. A problem shared is a problem halved. So talk to somebody. And a joy shared is a joy doubled. So I'll end on that bright note. Thank you both. It's been great to speak with you. Lots of great tips that you've shared there. And join me this time next week. And if you've enjoyed this session, please click on the chat and join our CMI community. Thank you, everybody. Take care.